Well, hello everybody, it's Mr. Lee David Carter here, and I want to really talk about an important topic here which I thought is going to be interesting, because when I listen to some of the myths and the questions and the most ridiculous comments that people come out with, I thought I've really got to talk about this subject. I thought it's really important to get this message out there and literally trying to educate people a little bit what it is, that regarding gender reassignment surgery when it comes to a penis. So I want to talk about the curiosity and myths of bottom surgery and having to go through that, because it was over a decade ago that I went through this. So I thought, let me just talk about this so the public can sort of have a better understanding of what it is when it comes to phalloplasty, medical terms, penises. Okay, so I wanted to talk about penises. Okay, now I know this is a topic that many are curious about, and the questions asked, the myths about it, and to many of the newbies out there as well, it can be a frightening thing to go through when having to make decisions about having the bottom surgery done. So hello everyone. So how's it hanging? Okay, so the general conversation is about penises. Okay, and now it was over a decade ago that I went through this, and I went through, should I say, like four operations, and one of them, the first one, was 12 hours, and it's a very, very complex surgery that you have to go through when constructing the penis. Okay, so before I even started the surgery, I heard about a lot of the negative, should I say, information that was out there beforehand, researching into it, and for the majority it can be seen as frightening when it comes to surgery, when it comes to gender reassignment surgery. So it's a major change for your body to go through, and within your life as a whole, with the information of the results, there's always risks involved with any surgery that you have. Okay, so it can be seen as frightening to many, so please don't believe in all you hear or what you, should I say, have been told, because the information can be very biased out there. Okay, when it comes to the public, the internet, people, and I've researched into the lower surgery, long before looking at options and what's available and the risks involved. Like any other surgery, there's always risks involved. And I remember one experience, but not personally, because I was at university at the time, over a decade ago, when I went through this. I went into hospital, had the first operation, 12 hours, and I remember from personal experience there was somebody next to me that was about 10 years younger than me that went through the same thing, and there was a little bit of a complication whereby there was something to do with the blood flow in the vein to the penis, and it needed to be corrected. But it's very, very rare that something like that happens, okay? I just went in to comfort the person and just reassure them that everything would be okay, and it was okay. And that's from personal experience. That was in Windsor, in should I say West London, by Windsor Castle, because I'm usually from London. And I remember being in that hospital with that person privately and speaking to them, and they were okay. And I'd just gone through a major operation myself there. So just to reassure you that these doctors that do these surgeries, they are very professional. They know what they're doing. They've been doing it for years. They're qualified professionals to do what they're doing. The doctor that I had, Dr. named Christopher, was one of the best surgery doctors in the country, in Harley Street, London. Okay, so if anybody is trying to go through this process and they want to be complete to who they are, please, I can reassure you that they are good at what they do and they know what they're doing. Okay, there are guys that have been born male and they may have lost their penises down to cancer or infection or other issues or problems where they're born, and there may be other issues where it's not grown properly, or other issues and so forth. And so because of that, they're about to go through the same process that we've gone through, and they were born male, assigned male at birth. So please just to reassure you that please don't be frightened of the risks or what you're thinking or whatever, because they know what they're doing. Okay, so to many out there that's hearing information or people saying things, don't listen to everything you hear because it's wrong. And I'm talking to you from first-hand experience, from my experience, what I've been through, that many seem to think and give you out those negative comments and what they're telling you. And I can tell you from my own experience that it's fully functional as a phalloplasty. The surgery is available to men that are assigned male at birth that have had problems, as I've just discussed. And from birth, any trolls out there, the negative comments they're putting out, I just, to say it's a useless tube, or, it's just really ridiculous comments, just ridiculous, okay? It's a very complex surgery, as I just said. So just to educate out of ignorance for all those out there, trolls, or, which I find absolutely ridiculous, and some of the comments is just ridiculously funny, some of them. When it's involved with a blood flow, there's a vein put in, there are feelings, there are nerves, you can achieve penetration, you have natural erections for some, there are things that help with the penetration, such as a pump put in, or an erectile device is fitted in one of the testicles. So it's not just penetration, there's a sexual like functioning going on. So the question of feeling, there is feeling from it, but not straight away. You need to give it time, maybe 2 to 6 months. From my experience, it takes time to heal. However, with the sensation loss, no, there isn't. Okay, but after about 6 months, I gained sensation, so it's quite amazing. Erotic sensation. If you're talking about boner or hard on or an erection, yes, you've got that. You do get that, okay? To many, sensation could be a frightening thing, to lose that sensation. Well, you don't, okay? I'm telling you now from experience, you don't lose the sensation, okay? Those feelings, you get the sensation, and it does come once you've healed, okay? So be patient with yourself. But for everyone out there, it's different when it comes to sensations. So to completely regain those sensations, you have to give it time. So anyone that's questioning that, it doesn't, if it doesn't look like a penis, for example, you're wrong. It does look like a penis. I'll give you another experience. Because it's a complex surgery. They know what they're doing. I went through 4 surgeries, 4 operations here to have a phalloplasty penis, and it's not true what people are saying, okay? So I'm proud of my manhood. I remember one experience, I was in the changing room with a man, and one of the guys come up to me, he turned around and said to me, "Oh, I wouldn't mind a Corey like that." Well, I'm from London originally, Cockney, and Corey means penis. And that was a really nice comment coming from him, right? He wasn't gay or anything like that. It was just an old man who's just looked at me and thought, So, and I've had that comment from a nurse and other people. Well, not just everybody, but I've had it from a nurse and, partner, whatever. So just a bit of advice out there for all those people that are curious, or the myths that have been said, the negative comments, the trolls, ridiculous comments, and whatever people out there, what things they say. I'm giving it to you now first hand. It's not true. Okay. So what I need to say is, because that experience I had in changing with him, he had no idea who I was. That's the funny thing about it. So you tell me, is it weird? Is it freaky? Does it look like a penis? Well, he didn't know who I was. Just in changing room full of men, having a shower, getting straight, stripping off, getting naked, going in the shower. There's your answer, first hand. So what are you going to say now? Okay. Anyway, I just wanted to put that message across. So there we go. The other thing I wanted to say is that, the other question is about penis size. Well, we're all different. I go into a changing room, they're all different. We're all different. We're not all the same. Like anything. Same as women. We're all different. Some are bigger than others, some are smaller, some are shaped differently. What does it matter? You know? We've got the same thing, but we're not all different. We're all the same. So when it comes to dicks and penises, we're all different sizes and shapes. So I hope that answers your question for some of you out there. The questions out there, the curiosity out there of people. Maybe if you look really close up, you see it's a penis. So yeah, things can go wrong, but yeah, it's not often. But yeah, if that answers the question, it is a penis. Okay. Anyway, this happens in life. Many of the surgeries, the transphobic trolls out there, they don't want to believe trans men can have a functional penis. Absolutely. Yeah, we do. So I have to laugh, okay, because I really need educating these people. They're so ridiculous. The comments to come out with, I mean, it's a joke. Seriously, come on. So I had to get this across, especially now, just finished a TV documentary film last year. I mean, it's gonna be a bit of a shock for the public. So I had to get this message across because people really do need to be educated. Some of the comments that come out is really ridiculous. Anyway, so I just wanted to put that across. And the other question is, whether you can have intercourse and you're functional. Well, my brother asked me this question a decade ago. Of course we're functional. Of course we can have intercourse. We can go all night long for days. Now ask me that. In fact, we've got a little bit of an advantage to some men. I hope that answers your question. Okay, anyway, jokes aside, yeah, there is a slight advantage because the erection part, some men can't hold it boner for too long, but we've got a little bit of an advantage there, depending how fit you are. But yeah, so yeah, I hope that answers your question too. But in any case, it's a frightening thing for anybody to go through, especially the newbies out there, or anybody really, for anyone at whatever age or whatever background. So, I'm just giving you, based on my experiences, that it answers some of the questions. And it was over a decade ago, but I wanted to reassure you that, when it comes to making choices and having the bottom surgery and those decisions that you want to make, and to try and remove any of those fears. And yeah, if there's any questions you want to ask, please give me some comments. Thanks for watching this video. Come follow me on my journey. And please press the subscribe button. You can reach me at www.leedavidcarter.com. So bye for now, everyone. Just follow your heart, be who you are, and I'm going to say bye for now. Love and light, namaste, speak to you all soon.